Time now for the Pat and Aaron Show Injury Report, presented by the Florida Orthopaedic Institute in partnership with Tampa General Hospital. Playoff time, and we're getting down to the nitty-gritty as we're at the Final Four. Joining us on the hotline, once again joining the show, Dr. Radnay is joining us. And Dr. Radnay, thanks so much for joining us today. Let's get right into it as we got some big games coming up here. Jalen Hurts, he's dealing with that knee injury for Philadelphia. He injured it in the third quarter of the game last week. He wore a knee brace the rest of the game. Let's start with the knee brace. What does that do if you injure your knee, you put that on? How does that help keep you in the game and keep you playing?
Yeah, hi, good morning. So a brace initially can help just because it provides a little bit of support and compression. The reality is in football, it's really difficult, especially at that position, and especially when you have a mobile quarterback, to provide a lot of complete support because it wraps around the muscles in the thigh and the leg, and it tries to control the motion, but you still have to allow the knee to bend and rotate somewhat. So it's trying to protect the player a little bit with excess motion.
So when you've got an injury, but you're wearing a brace to protect against some of that movement, is there any danger to doing too much with that injury, with that knee, because you feel the support that is external and not really there internally?
Yeah, I mean, there's certainly a danger. I think the reality is that when he first goes down, the doctors there are able to examine him and try and rule out something very serious. And so if they're thinking it's something maybe like a muscle injury or muscle contusion, like probably what he has, then they give him something like this to try and help protect him somewhat, to let him still play and give him some protection. And as we saw, I mean, he was able to play. He didn't even miss a snap, but certainly he had somewhat limited mobility once he was wearing the brace.
Doctor, when I go play pickup hoops or I'm playing softball, inevitably there's always people that are putting those like compression sleeves on their arms, sometimes on their knees. What do those do other than look really cool?
Yeah, other than looking good, I mean, the bottom line, it can provide some protection. Sometimes it's really almost a reminder to you as the athlete to try and avoid certain activities in certain positions, just to avoid making the injury worse. But certainly it can prevent some extremes depending on how stiff the brace is, and can prevent extreme motion or rotation that could potentially injure it further.
Washington offensive lineman Sam Cosmi, he tore his ACL last week in the Commanders' playoff game. This late in the year, when you're into the playoffs, how much of next season is that going to cost him? And how different is the rehab for a guy like that that's pushing 300 pounds versus a lighter player, a running back or a receiver or somebody like that?
Yeah, I mean, so for someone like this, it's really unfortunate because he's actually hasn't missed a single snap in 2 seasons. And unfortunately, when you tear your ACL and your livelihood is something like football where you need to start, stop, cut, the only way you can really treat that is with surgery. And when you do the surgery, you can have a great surgery, but this is one of those surgeries you really have to rehabilitate it and take the time. And for a sport like football, I mean, that's really, we're talking a good 9 to 12 months. Now, for someone like offensive lineman, which really requires much more of a stand-up and push-pull kind of thing as opposed to, sliding and cutting and that kind of stuff, he will have a better outcome once he's healed. So the worst and the toughest positions to come back from this kind of surgery is more the start, stop, cutting, like a running back, defensive lineman, linebacker. But with that kind of weight and that kind of stress, you really got to go through the whole rehab. And sometimes you get partial way through the rehab and you're feeling good. You almost have to protect yourself from yourself, but you really just have to go through a structured process, getting your strength back, your mobility, your flexibility, and your balance, because you really want to minimize your injury risk going forward.
Bills safety Taylor Rapp, he's day-to-day with a hip injury. What type of hip injury are we dealing with here?
It sounds like his injury is a hip pointer, which is a pretty common injury in football where you get basically a direct blow to the top of your pelvis, to the bone, either from a tackle if you hit the ground hard, and he seemed to be laying on the ground when one of the other players ran into him. So fortunately, it doesn't seem like it's anything more serious than that, but he's really just limited by pain. So that recovery can take anywhere from a few weeks to a few months. He didn't play last week. He actually didn't practice yesterday, but it's just a question of when he feels comfortable enough to get back, and hopefully gets back in this weekend.
We've spoken so much about the advancements with ACL injuries, and I think back when you think about hip injuries to the one that ended Bo Jackson's career that many years ago. Would that same injury, in your opinion, doctor, end a career today, or is the advancement in technology helped out with an injury like that, like it has with ACLs?
So the injury that Taylor Rapp has is nothing anywhere near as serious as those injuries.
Of course.
I think the injury you're talking about with Bo Jackson, unfortunately, that injury can still happen. I think we're able to deal with that better, especially our diagnosis of something like that is also better, so we can treat it more quickly, but that's a significant injury. I think ACLs in general are very common. We have over 300,000 of those surgeries every day. But the bottom line is, in a sport like football, it's not a benign injury when you think that average career is only 3 years, so it can be still difficult to recover from. So again, surgery, I think, works really well for these players in this particular position. Hopefully he's going to make a good recovery, but it's going to take some time.
Nicole Hardman's been on the injury reserve since early December, almost 2 months now after suffering a knee injury in practice. What do you expect Hardman's going to look like? Has he had enough time to recover here?
Well, it's interesting because he sustained this injury and then he had some type of cleanup procedure, so it could have been maybe a small meniscus tear, some type of cartilage injury. He was supposed to come back at the end of the season, and then it was prolonged, and he was supposed to come off injury reserve last week, but now he was practicing last week. It looks like he hasn't really progressed well, so they actually decided yesterday that he's not going to be activated from the injury reserve list, so his season's over, actually.
So this might be an incredibly stupid question, but I was going to ask it anyways. There are a lot of different knee injuries. It feels like are there more ligaments within the knee area? What is it about the knee in particular that we see so many more? And is it just the weight bearing aspect of the knee more than we see, say, ankles or elbows or most of the other joints in our body?
I mean, that's a great question. I think some of it can be sport dependent too, but there's certainly just a lot of stresses that go through each of the joints, especially in the lower extremity. And in sports like NFL in particular, where you have not just running, but you have a lot of the start and the stop and the cutting. And especially when you realize that the ligament size really doesn't change depending on how big you are. But obviously in these NFL players, especially today, you have tremendous increase in mass, tremendous increase in size, tremendous increase in speed. So the forces going through the knee are just so much greater now. So that's, I think, a big reason why you're seeing so many more of these injuries now than you did in the past.
Well, we really appreciate all the insight, as always, Dr. Radnay. And the injury report on the Pat and Aaron Show, presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. Dr. Radnay, thank you so much. Really appreciate it.
Thanks a lot. Have a great day.
Thanks, Doc.
Love speaking with our doctors every single week.
You looked disappointed that time when he said great question. You looked like you were angry about that one.
Well, yeah, I'm getting a little annoyed by it.
I mean, listen, I even led that one off by saying I thought it might be a really stupid question.
But that's what I was annoyed with. I think that you set it up for him to feel kind of bad and be like, actually, it's a great question.
Not at all what I was doing. I was concerned it was a dumb question.